Bismillah ar-Rahman ar-Rahim. In this video, we will discuss the pathogenesis of multiple sclerosis. As you know, multiple sclerosis is an autoimmune disease, which means that we have an immunologic response against an autoantigen, against a self-antigen. And of course, in multiple sclerosis, naturally, this antigen must be a myelin antigen. So we have a response, immunologic response, against a myelin antigen. We don't know exactly what is the myelin antigen that starts the whole process, but we have enough evidence to believe that the process is an autoimmune response against this myelin antigen. The immunologic response that occurs in multiple sclerosis is mainly T-cell mediated. It's a cellular mediated immunity. Although humoral immunity possibly plays a role, but mainly the process is related to T cells. So we have a myelin antigen. This antigen is recognized by T helper cells as non-self. Upon recognition, T helpers differentiate into T helper 1 and T helper 17. T helper 1, as you know, produces interferon gamma. And interferon gamma recruits macrophages. T helper 17 produces certain cytokines, including cytokine 17. And cytokine 17 recruits white blood cells. These white blood cells will secrete cytokines that cause tissue destruction, myelin destruction. So, كيف بصير المالتيبل سكليروسيس؟ القصة تبدأ بأنتيجين from myelin, a self-antigen. And the self-antigen recognized by helper cells which differentiate into mainly T helper 1 and T helper 17. T helper 1 زي ما بنعرف produces interferon gamma that recruits macrophages which cause tissue destruction and phagocytosis. T helper 17 produces cytokines including cytokine 17, and these recruit white blood cells which produce another cytokine or several other cytokines, and this causes myelin destruction. This is how myelin is destroyed by T helper cells. مش بس T helper cells play a role in the destruction، بس كمان في عندي CD8 اللي هم T killer cells or cytotoxic cells. T cytotoxic cells also are thought to play a role, and B cells also play a role in the destruction. الإيفيدنس إنه ليش كيف ال B cells are involved عن طريق إنه when we examine the CSF of patients with multiple sclerosis رح نلاقي عندهم إشي اسمه oligoclonal bands. هذه رح نحكي عنها بالمحاضرة إن شاء الله لما نعمل discussion عن about this lecture. We will talk about oligoclonal bands. إذن صحيح the main players are the T helper cells, but also T helper cytotoxic cells and B cells probably do play a role in the pathogenesis of multiple sclerosis. Okay. إذن إحنا قلنا كل القصة إنه في عندي reaction against a self-antigen. إيش بخلي الناس susceptible إنه يصير في عندهم this immunologic reaction to self-antigen? Be a certain genetic predisposition. ليش أنا وياكم ما تصير عنا هاي البروسيس؟ ليش ما يصير في عنا reaction against our myelin and our myelin proteins? Not every person will have this. It only occurs in genetically susceptible individuals. The association, there is association with HLA-DR2. there's association with certain polymorphisms in interleukin 2 and interleukin 17 receptors. These increase the susceptibility, certain polymorphisms. So the disease occurs in genetically susceptible individuals, but not every genetically susceptible individual will have the disease. We need an environmental trigger. And we think probably viral infections are the environmental trigger that start the process. إذا إحنا نحط الستوري كلها مع بعض. المالتيبل سكليروسيس اوكي genetically susceptible individuals. هدول genetically susceptible individuals إذا تعرضوا ل environmental trigger, their T helper cells will be stimulated and the cascade which we described previously occurs. This will result in destruction of the myelin. Evidence في عنا evidence قلنا إنه فعلا disease there is genetic susceptibility of the disease. الإيفيدنس جاي من إنه if there is a first degree relative affected, you have a 15 times more chance of developing multiple sclerosis. Also, there is a 25% concordance rate to be affected in homozygotic twins. إذا كانوا homozygotic twins هذا بيعطي 25% إنه إذا واحد فيهم affected, the other will be affected. So by this we know that there must be some genetic susceptibility. طبعا هاي الستوري is common بكل الautoimmune diseases إنه there is genetic susceptibility. This genetic susceptibility needs an environmental trigger, and the environmental trigger will start the autoimmune response. هاي أهم ideas relating to the pathogenesis of multiple sclerosis. Thank you.